All right, so if you didn't know, now you know. I'm gonna back up on our slides quite a bit here since it began with the end. Okay. Oh my goodness. So see, it's a lot. So this is the update since January 19th. So this is hot off the press since Monday. And I know I sent you a lot of information yesterday. Some of that information we'll talk about today, but we're not addressing all of it. So if you have questions about it, we can talk about that at the end. So the focus for the Ready School Safe Learners and for us as a school district is that every student deserves high quality instruction and high quality time to learn, grow, and thrive, which means we will continue to have Albany online, comprehensive distance learning, and in-person hybrid learning together even after we're back in person. We believe that will be all year. We're not anticipating changing having all three options once hybrid begins. Of course, staff and student safety is a top priority for us, and so there are considerations for us as we move into in-person, expanding in-person. We already have about 350 students who are in in-person learning right now. They are in small group instruction for specialized needs. Here are the new metrics that were shared by the state regarding when it is safe to have students at school. So these numbers have changed quite a bit, both in that they used to be required mandatory numbers. Now they're considered advisory numbers, but the caps on the numbers, the range of the numbers has changed dramatically as well. So when we are at a case cohort, a case rate count, excuse me, that exceeds 350 cases, then we need to be in all distance learning or moving back to distance learning. When we are between 200 cases and 350 cases, we can begin transitioning to on-site instruction for elementary students only. So that's 200 to 350 students. Once we are in the yellow zone, that is still an elementary focus, but there isn't the long time period for transition for elementary. All elementary is good to go, all clear, and you can begin a slow transition to middle school and high school, though you're really focused on what is called limited in-person instruction during that time, which means small, very small groups of kids for purposeful time, but not in regularly scheduled classes. And then when you get to this green area where you have 50 or fewer cases per 100,000, then you're set to have on-site instruction. Sorry, I should have flipped that page for you so you could read that yourself. So this information, this just gives you the information. This is available in the Ready School Safe Learners. It's actually a larger chart, but because of the size of our county, only part of the chart applies to us. If we were in a smaller county, then we would be calculating things differently. When we look at our local community against those numbers, so remember it was the green, yellow, orange, and then red. We are currently in this orange phase. So both Lynn and Benton counties, which you can see here on this slide, are in the orange category. Benton County had about 320 cases per 100,000 this last 2-week period. And Lynn County, I believe it was 301 cases. So you can see we're quite a ways off of where we can easily have all K-12 students on site, but we have entered into this area that is now this hybrid transition. And these numbers used to be much lower prior to Monday's release. The cap used to be 200 and now it is raised up to 350. So that's a dramatic change. Again, now these are advisory rather than mandatory. So there are other ways that if we decide to not heed the advice and go more rapidly into in-person instruction, there are other steps that we need to take, protocols that we need to take in order to make that happen. I'm going to flip through the ones we've already talked about. We are all in this together. I know you feel this, and I know you feel like I say this all the time, but I just want to say this is a collective community effort, and trying to get our students the support they need, the social emotional engagement. If you have a student who's really struggling there, I want you to know I have heard that feedback. I know that that's a very real thing for us that we need to address, and part of a desire and drive to have students in person. I feel that as well. And we also need to take all of these community precautions that we'll talk about today too, to help make sure that we can get kids in person as quickly as possible and as safely as possible, and then we keep them in school and don't need to send them home. We also always have a racial equity lens on the work that we're doing. I know that you've heard about that this year, and we know that actions that promote equity for everybody, that promote equity actually benefits everybody. And part of that means that we recognize that there are inequities in how COVID impacts certain communities within Greater Albany Public Schools. So we know that the pandemic has disproportionately impacted our families of color. We also know that we have situations where just the pandemic itself has had a real negative impact on our low income families and how they're able to engage in school. So we're very aware of that. And here are the actual updates. So operating schools in person is now a local decision. It relies on us GAPS working closely with public health. We work with Lynn County Public Health primarily, but we also, through Dr. Smith, partner with Benton County Public Health. And we also must follow the requirements that are outlined in the RSSL. So there are requirements still, and there are pieces that are advisory. The advisory metrics are based upon the county, like I just showed you, and we get updates on that every week. One of the things we don't have a choice on are the health and safety protocols. I'll go over those with you so that you know when your child comes back in person, what that learning environment will be like for your child and what precautions they will need to be taking and that the staff will be taking to help protect them. We have certain requirements around training of all staff. All staff have to be familiar with the first 3 sections of the guidance from the state. And then we also need to train staff around the health and safety protocols. And Dr. Smith has really been making sure that we are doing that well, and we're doing it systematically and systemically. So here are those protocols. It's required that we conduct a risk assessment and review requirements around OSHA. So we look at our community, our school, and think about where might be some of the risks for students and staff when they come in. We need to have an opportunity, a place where staff can make anonymous complaints, and we have an actual anonymous line that people email us complaints for. That's already in place. We have protocols in place where we notify Lynn County Public Health or Benton County Public Health, depending on the correct agency, when we discover student or staff cases. And then we also have plans for how we clean, disinfect, and sanitize. And there are certain products that the government requires we use. So there are certain standards that we have to adhere to. We also, when kids come to school, so the students who are already at school, we're already doing this with, our staff and our students both are screened when they get on the bus and when they are walking into the school building. It can be done visually, and it often is, but for us, we actually have questions that we're asking of staff every day, and we actually have some questions that we're also asking of students when they arrive at school. Also required is that we establish a minimum of 35 square feet per person in each learning space. So when you think about our classrooms and how many kids we've typically had within a classroom, we simply cannot have that many students at school at one time because we can't have that many kids in a single classroom and respect that 35 square feet of distance. We also need to make sure that kids can stand in line, like if they're waiting for the bathroom, but we need to make sure that we minimize that time, and that wherever we are able, that we have 6 feet of physical distance surrounding every student. So you'll see differences where when you walk into the school, there may be markers on the floors to respect that 6 feet. There also maybe when you walk into the classroom, you'll see that desks are arranged very differently. And actually, in many cases, tables have been replaced with desks. Students can only cannot be a part of any single cohort or multiple cohorts that exceed 100 people within the educational week. So your child can only be in contact with 99 other kids per week. That's how we need to build our schedules. So it also limits, if you have a secondary student, it limits how we move your child through the school day. It also, again, is part of the limitations then that we have on class size. We have a system where daily logs are kept when students arrive and staff arrive, and we minimize the number of staff that your child will come into contact with. So if you have an elementary child, you're accustomed to the music teacher working in person with your child and with all the other classrooms, right? We cannot do that, because what would happen if that music teacher came down with COVID? All of the students that music teacher has had contact with would all need to go home. So that pretty much wipes out the entire school. So the way we build the schedule and how certain teachers are interacting with your child will look different in person. It may look very similar to how they're interacting with those professionals right now in distance learning. We have to direct students and staff to stay home if they have symptoms. So if children come to school or get on the bus and they show symptoms, we have to call you and say, you've got to come pick up your kiddo. We have isolation rooms that are required to be in place at every single site. So we have an isolation room with a staff member who's trained in how to monitor the isolation room so that your child can wait in a safe environment to be picked up. And Rachel and Lisa, please interrupt me if I'm missing things. I know I'm running through quickly. We also work with Linn County Public Health and Benton County, so they'll tell us if there are certain actions that we need to take to protect folks who may have been exposed.
A common question that we get, Superintendent Goff, especially with the visual screening, is regarding why do we not take temperatures? And so if we could have Rachel speak to that a little bit, specifically as it relates to pediatric cases, and why is it that we don't take temperatures as well as a visual screening before students either enter a building or get on a bus?
I think that's a great question. And I think we saw a lot more temperature taking earlier in the pandemic. But what we've since learned is that in both adult and pediatric cases in Oregon, only about 20% of people are actually reporting having a fever as one of their symptoms. So we're seeing less fevers as a common identifier. And on top of that, it also requires us to get really close to someone. So that risk of having to get nearby to take a temperature that may not give us accurate information on if someone has COVID or not is really one of those mitigating circumstances where we would rather keep that distance and do a visual screen and then ask follow-up screening questions if necessary, rather than doing the temperature taking for every student, which would put that temperature taker at greater risk for contracting COVID.
Thank you. So another step that we take is that we provide masks to all of our staff, and we require that they wear masks unless they have a medical issue. And the same holds true for students all the way down to kindergarten. And we're also providing masks for all of our students. So we know that you have masks at home, and those are fine. You can absolutely use those masks. We will give you the outline for what specifications the masks need to hold up to, but certainly kids can use their favorite masks from home. We'll also have masks available for students. And sometimes students may be in a class like a speech class where they're learning how to pronounce words, and they're working with a speech pathologist closely, but they need to see their mouth. So in that case, we'll provide a face shield for those moments, and so the speech path can see the student, and the speech path themselves may also need to have just a shield on at certain times. But almost all the time, everybody will be fully masked, and people already are who are working on site. So students who decide not to, if your family is not comfortable with your child wearing a mask, of course, that is absolutely fine. And so what we will do in that case is keep your child enrolled in comprehensive distance learning. So do know that if you have a decision where your child just simply can't wear a mask, or if your child or if your family just decides that that's not what your choice is, then your child will enroll in comprehensive distance learning. There are certain cases where a child has you may have a student with disabilities where mask wearing is problematic, and in that case we work with you to make sure that your child can stay engaged as long as it doesn't risk health and safety. It's important to know that young children, so the littles, the elementary kids, are not a significant source of spread for COVID. And there is a section within the RSSL document that talks about little kids and information regarding that. We are also aware that during mealtime, we want to make sure that we're keeping kids still spaced apart by 6 feet, and that's unfamiliar. That will feel weird to your children to be 6 feet away from their friends while they're eating. And what we're looking at doing is, what are all of the other protocols we can put in place while students are eating? Of course, we'll have kids use their wash their hands or use an alcohol-based sanitizer after eating, but we want to minimize the amount of time that students are spending without a face covering on. Face coverings are also required on the school bus. So from the moment that kiddos get on the bus, they need to have that mask on until they get off the bus if they're bus riders. We are maximizing our ventilation. We have MERV. If you know the MERV settings, I believe all of our classrooms are at a MERV 13 or better. And that is what happens when the air circulates really well. We certainly are looking also at where we can have windows open if the weather permits. I want to give you an update on the vaccine itself. So this is actually updated as of 5 o'clock today. The first 2 weeks of January, Lynn County Public Health received 100 doses of the vaccine each week. So 100 doses of vaccine for the entire population of 1A was given to Lynn County Public Health. Oregon this week from the federal government received no doses of the vaccine. So we are really at a heightened level of concern regarding the speed at which we are able to get all of our staff members vaccinated. We have been working really closely with Lynn County Public Health. We've had a great working relationship with them. They last Saturday held a very small vaccination clinic for our staff members, the Lynn County School District staff members who are in category 1A, like Nurse Rachel is in that category. And through that and through other methods, we have had 12% of our staff have their first dose of the vaccine. We also have 13% of our staff who are making the personal decision to not be vaccinated. And so that you know, that is not something that we can mandate as a school district. So that is a choice that they are able to make. I have been working over the last 3-4 weeks since the governor's announcement fervently with Lynn County Public Health. I've been in close contact with our county commission, particularly Commissioner Nyquist has been extremely helpful. I have been in conversation with Colt Gill, who's the head of public instruction for the state, and Scott Nine, who is his assistant. I have been in contact with the education representative for Governor Brown's office, Lindsay Capps, who has also been very helpful and is advocating for Oregon and for Lynn County to get more doses of vaccine. I've been in contact with both Senator Gelzer and with Shelley Bossart-Davis, who has been fantastic. Representative Bossart-Davis has been a fantastic advocate for Lynn County. And then we as area superintendents are really working on this issue. The issue, just I want to make it crystal clear, is we need vaccines in Lynn County. So if you know any of those people I just mentioned, or if you happen to know the governor, anything you can do would be greatly appreciated. The first week that we're going to be able to have for mass vaccination clinics for our staff in Greater Albany is with Lynn County Public Health, and it'll be the week of February 2nd. Now, that vaccine will be the Moderna vaccine. That vaccine, you need to have 4 weeks in between your first and your second dose. So the earliest, if we were able to get all of our staff vaccinated, getting their first dose the week of February 2nd, the earliest that they would all get their second dose would be the week of March 2nd. That then means that they would not be fully vaccinated and covered until the end of the week of March 16th, which is the 2-week period following the week of March 2nd. Because the second dose of the vaccine, you need to wait another 2 weeks for it to be fully effective. Whew. Okay, that was pretty good. So this is our time for questions, and I know you probably have written a lot already, and so we are going to try to tag team and get through questions as much as we can. If we are unable to answer your question, we have a great assistant in Heather Huzefka, who is our federal programs director, who is going to take notes for us so that we can be sure to add them to the communications that you get from us later.
So Superintendent Goff, I have been trying to answer what I could in the chat and not all. So what I'll do is I'll scroll back up to the top and just kind of go through the ones that I don't know that we have answered. So I'm going to just start with, there were some questions around Parent Squared. Please know that there are several systems in the school district that different teachers and schools use right now for parent communication. Parent Square is the mechanism that we are trying to transition to so that we have one method for parent communication. So if you have a school and one school uses School Messenger, or one uses an auto dialer, or one, if you have several students in the system at different levels, you'll know sometimes how difficult that can be to keep up with all of it. And so that is Parent Squared. I know schools will likely still use their email listserv, but that's the Parent Square is the mechanism that we're trying to use to get everybody kind of on the same page. So want to make that known. Okay, so we have some, the first question was just around what would you recommend for young kids, kinder, elementary, and I would actually say K-12 kids to prepare them for what changes will look like for hybrid school.
So I can start with that, and then Lisa, of course, jump in. Anybody jump in. So, excuse me, frog. What I would recommend, first of all, is get your child to start practicing mask wearing. If you're not wearing masks at home for longer periods of time, I would start doing that so that you build up for them a time period of at least 3 hours a day. If they're going to be riding a bus, they are probably going to be in a mask for about 4 hours during the day. They'll have some mask breaks in that time as well, but that's probably the biggest thing they're going to need to get used to. The other thing is just the physical spacing. So recognizing when you're playing, when you're having alongside play with your child, talking to them about when you go to school, this will be different. Your friend will be this far away from you, and you'll be talking to your friend from this far away, so that your child isn't shocked when they get to school and can no longer play adjacent to their best friend. Having some practice with you so that they can normalize that is really important. And the other thing I'd say before I hand it over to Assistant Superintendent Harlan is just reassuring them that the steps that are being taken at school are for your child's safety, to keep them safe. And so everything that we're doing is focusing on keeping them safe and taking care of them. None of it is scary. All of it is just so that everyone in the room takes care of each other, because that's what we do in our community. We take care of each other. It's a really important message for your child. Anything to add to that?
I think more questions actually will come up, and we'll probably dive deeper. So I'm just going to say one comment saying we need kids back in class, not just little kids. All of our kids suffering academically and mentally. No services offered for kids, specific about SPED services, and a student who's a junior who is nearly failing all of them. Some just can't learn online. Another comment about
just a second. So I do want to speak to that a little bit. I do want to note that we are having real success in keeping kids and staff safe in the limited in-person format, where we have very small groups of students for a very short period of time, less than 2 hours. The maximum is 2 hours, and not necessarily every day. So some of these groups may come on a Tuesday and a Thursday. Others may come in a different schedule. We are having really good luck with that format in keeping people safe. We've had no one get sick from utilizing that format. So even when we do set the in-person date, we will also be paying attention to how do we address some of the needs that you just talked about in a different way while we lead up to fully in person.
Okay, so explaining how children will potentially keep their original teacher during the transition. And so I can speak to that. In most instances, it won't necessarily be true in every instance, but essentially what we've been trying to do is see who wants comprehensive distance learning, who wants this hybrid in-person. So for elementary schools, for example, a teacher might have an AM session that is hybrid in-person and a PM session that is virtual. For middle school and high schools, it will likely look like sections. Some sections of classes will be hybrid, some sections of classes will be virtual. Again, we've really tried to, and I think this is specifically for elementary because their schedule doesn't change throughout the year. It doesn't change at semester. Have really tried to keep them with their original teacher, although we know that wasn't possible in every instance, just because the number of students in a specific grade level who wanted comprehensive distance learning or hybrid in-person didn't work out for that to happen. Does Albany have to count both counties' numbers for those ranges? Yes, because the school district falls in both Benton and Lynn counties, we have to count both counties for that. Just a comment, and Superintendent Goff, feel free to answer. It says, why hasn't GAPS addressed the older kids? They have lost so much already. I'm not sure. I feel like we've tried to address the older kids, and so I'm not sure if part of that comment is just in reference to the fact that most of the metrics call for getting younger students back in first. And the reason being a lot, but mostly it's very difficult to teach children how to read in one-to-one correspondence over a computer, which they have very little experience, whereas high schoolers have much more experience being able to type and utilize the internet. Also that we know that younger kiddos actually spread it less often than older ones. And so, I mean, that's part of it, but we certainly have tried to address all of our students. If this is a great question, next one, if they're advisory, these metrics, why can't the GAPS board just put all kids, not just elementary students, back whenever they decide it's best? I'm gonna tackle that one and then you can jump in, Superintendent Goff, if you want. So a few things. One, and this comment comes up later, we know that if we are waiting for more information from our insurance coverer. There is one insurance company who covers school districts in the state of Oregon. There are 3 of the big school districts that are self-insured. That insurance company is PACE. And what they've previously said is to school districts, if you don't follow the guidance, then you will not be insured. You will be liable in instances of COVID, right? And we all know that there are different levels of risk. And so we're waiting for just legal counsel to say, if we were to open in the red, would we still have insurance coverage? 1. And 2, if we open in the red, there are other requirements that we must meet. One of them is that if we open in the red, which is, according to those metrics, we have to ensure that there's on-site testing for every symptomatic student or staff. Now, as you can imagine, to have on-site testing available at 21 schools, we have to work with Lynn County Health to be able to do that. We don't have access to tests. We know our health departments do. And so Lynn County Health is going to have to work with school districts to be able to offer on-site testing at every single one of their schools if they choose to open in the red and still have insurance coverage. So there are some other requirements that go along with some of these metrics that aren't as simple as, why can't we just do what we want? I mean, I guess we could, but there would be consequences that I don't think financial liability and safety liability that the district would reasonably incur.
The other piece is some of what I talked to you about earlier is required. So the 35 square feet per person in a room required, 6 feet of distance wherever possible required. So there are pieces where we just couldn't get all the kids back to in person because of what Lisa said, and then there are other requirements as well.
A question about disinfecting or cleaning classrooms between cohorts. Yes, we have a cleaning protocol. We have supplies that are part of that protocol and staff actually that have to be trained. They don't include UV lights. They include other equipment. Why is there such a different schedule for elementary? No school starting in the 8 o'clock hour, either really early or late. This is for the hybrid schedule. And then the PM kids are at school until 4 p.m. I think this is Dale. Good luck with the focus that late in the afternoon. Throws off the schedule. Part of the reason the hybrid schedule changes is because of busing. We currently have to make sure that we get students there kind of in routes and in shifts, and we have a limited number of bus drivers. So if you are interested in driving a school bus, we will train you, and
we will train you. You will get your certification through us, and we would really be happy to have you on our team.
Yes. Yes, but we are limited in the number of bus drivers and the number of buses. So we actually don't roll bus routes for all of the schools at the same time because we're not able to do that. If we stay within distance learning when schools go to hybrid, Katie, thank you for the question. We actually have gotten this one a lot. And we would prefer for the numbers to be down lower before I send my kids to school. Can we choose comprehensive distance learning and then come back to hybrid midway once we feel comfortable with what the situation is? Or do we need to finish the year with distance learning?
Sorry, I was reading the chat. Was there a question?
Yep. So, and the answer is.
Okay, so the answer is no. I think I know what the question was. So the question is, if you start in CDL, can you go to hybrid and vice versa? Okay. So the answer is a little complicated. It is easier for us to be able to move you from hybrid to CDL. So you can do that at any time after you go back in person. If you change your mind, easy peasy, we can figure that out for you. Because of the space requirements and the maximum cap of kids we can have in a room, we're scheduling hybrid pretty tightly. So we don't have extra spots for you if you start in CDL and you want to get into hybrid. So in that case, that would likely need to wait until the quarter time, especially for middle and high school students. We wouldn't be able to move you back and forth. So we can move you one direction from hybrid to CDL.
It would be space dependent for sure. Many parents with families in other states have reported a cycle of in-person instruction. Then you have to go to comprehensive distance learning for 14 days because of a positive case in the cohort. And then you go back in person and then you have to go back to CDL. Has GAPS considered this problem? Does the back and forth create a greater negative impact for further instability for students and families?
Yeah, so we've certainly considered it. If we looked at opening in the red, we would be taking a real risk of that happening. Frankly, high up in the orange, which is where we are right now, still running a pretty good risk of that happening. Also, without having staff vaccinated, a much larger risk of that happening. So as we are weighing this decision, these are considerations. We don't want our kids going back and forth. Okay, we were in school this week. Okay, we're only there 2 days and now we're out for 10 days and everybody's learning from home again. Okay, we come back. We don't want that back and forth. So we want to be really mindful about timing so that we can keep kids at school.
And all that to say, we also know that if there is a positive case, right, in a cohort and exposure, then that cohort will need to quarantine. Rachel, you might be able to answer this too. What's the safety protocol for children getting on the bus? And then what's the screening process for children before they get on, or even, maybe they don't ride the bus coming into the building. So what's the visual screening process? You talked about it a little in the questions.
The visual screening process has been guided by a lot of ODE's recommendations, and it's really a chance to look at our students and see, do they look unwell? So either they might have flushed or red cheeks, they might look really tired, or just look, especially for our teachers that know our students really well, do they look off that day in some way? Are they coughing? That's a really big one. Or, a lot of sneezing, runny nose. So it's a lot of those visual cues that would give us a sense of if the student's feeling unwell, and we'll be doing that when they get on the bus and also when they enter the school. And then whoever maybe triggers something with that visual screen, then they'll go to the isolation room and we'll ask further questions, take temperatures, do all those things.
Thanks, Nurse Rachel. A great question, Alexandra. At the start of the year, there was talking about K-5 going AB days, and now it's AM and PM cohorts. That's tough because it doesn't support working parents getting back to work. What was the reasoning for the change? I will tell you there were two main reasons. One, elementary really feeling strongly that they wanted to see their kids as much as possible. So 4 days a week instead of 2 days a week, and also the ability to provide meals to students when they're at school for 4 days. And so there was a lot of conversation around depending on which days you were there, teachers in person could still go 4 or 5 days. If you weren't, the cohort there on Friday, that was worrisome to folks. You've said that we won't know an in-person date tonight. Is there an idea of when you will decide to go back under advisory, whether we'll wait? We need to have a plan. So at the last school board meeting, Superintendent Goff put together, the charge was a draft timeline of when we could return to hybrid to get the school board's input. We did that. We've gotten staff input, and now getting parent input, as well as waiting for some additional information that we talked about a little bit earlier. And then a recommendation, a staff recommendation, will go to the board on Monday night. Okay, I'm scrolling through because I've answered some of them in the chat. Yep. How will the district enforce the mask quality requirements? So the quality requirements are a 2-ply. For example, if a person is wearing 2 layers of a lace as a face covering, how will we address that? Well, we'll address that with the student and the family by offering them, we'll have extra masks, boxes of masks everywhere, by offering them a mask that they'll have to wear. And again, we're not forcing students and families to wear masks. Comprehensive distance learning is available for anybody who doesn't want to go to school wearing a mask. But if you come to school in person, you will have to wear a mask. That's students and staff. So there isn't the option of a student just simply saying, for whatever reason, I'm going to wear 2 layers of a lace mask. That won't be acceptable. That's a requirement.
We have quite a few questions about state testing. So the state of Oregon has requested a waiver from state testing again this year. We had one last year from the federal government. They've requested another, and we're just waiting to hear. So right now, state testing is still on, but just know that the state has requested a waiver for that. Accompanying that, I want to comment that a few people have been concerned about how far your child may be falling behind. The reality is that children are learning differently right now. So they're learning different skills. They're learning a different way of working out their own frustrations. They're also still learning academics. They are still learning from their teachers. Their teachers are working extremely hard and engaging them in critical thinking and important work. Please don't fear that your child is falling behind. Every child in the world right now is in this situation. It's not just a child, it's not just the other children in Albany or the other children in the state. Every child in the country and across the world is experiencing this disruption to the life they knew, the way that teaching and learning looks, the way that they live at home, the way they interact in the community. Every single child is going through that. And I want to make sure that you understand that we're very aware of the academic needs of your child. We're also aware of the social emotional needs, and we know that we need to provide more opportunities for your child in that area. And we're also aware of how your child is growing and learning in so many other ways than we would typically be engaging them during a regular school year.
So the next comment is, how can we make sure our children are not being educated with someone who forgoes the vaccines? That's actually personal medical information you won't know. You will not know if your teacher chose to be vaccinated or not, and that's not something that we would ever be able to release to you. Okay, question about contact, the definition of a contact and what guidelines are we following? We are following the OHA and the ODE guidelines, which is the CDC guideline of 6, actually, Nurse Rachel, I believe it is if you've been within 6 feet for a cumulative 15 minutes at any point during a 24-hour period.
Yes, and regardless of if you're wearing masks or not. So the new change was the cumulative 15 minutes piece. And I think probably some of the questions from what I'm seeing in the chat are related to quarantining one person versus a whole cohort. So when it comes to defining who quarantines, we get the advice of our local public health authorities. And they have all recommended that if someone tests positive in a cohort, that we quarantine that whole cohort. Because of that 15-minute rule, it's going to be really hard to guarantee who exactly was within that 6 feet for 15 minutes or more and who was not. So that's our local public health's recommendation.
Question about what will distance learning look like for high school? That will be on a kind of a, I hate to say A-B, but it is like a Monday, Thursday, Tuesday, Friday, on-off days. Similar in that the hybrid in-person will be much fewer students because you still have to have 6 feet of distance and you have to have 35 square feet per human in that space. Question, so will we have to wait until all of the staff are vaccinated before starting the hybrid schedule? Again, we'll have a staff recommendation that goes to the board about the potential timeline for a hybrid start that goes Monday, and it will take into account major factors such as vaccine availability, the current case counts and whether that's trending up or not. That's one of the factors to look at is the current trending of the case counts, and then also information from our insurance carrier. What will CDL look like for those that decide to stay with it? Will kids keep their current schedules? So CDL will look similar, but once we go to hybrid, what we'll do is have all of the students on a similar schedule. So for example, right now, everyone's in comprehensive distance learning, which means you have these interactions, virtual interactions with your class and teacher for a certain amount of time during the day. Well, when we go to hybrid, those classes essentially will have much fewer potentially students in them. And for example, at the elementary level, you will have basically an AM or PM session with your teacher virtually, kind of like you do now, but it will be for a half-day session. And then you'll do asynchronous work the other half because your teacher will be with hybrid in-person students for half, if that makes sense. And so that will be similar at the middle school and the high school levels as well. High school, it will be by days. So teachers will be teaching a course, for instance, with a small group of hybrid in person, and then maybe teaching that same course to a group of comprehensive distance learning students, right, in a different period. Because we'll have all of the students and some of them will be in one model and some in another. When we selected the hybrid, this was before the metrics were advisory, before the superintendent report showed how many teachers feel unsafe going back before they are vaccinated. Will we be selecting again changes? Superintendent Goff.
Yes, so we are definitely going to need to reach out to parents regarding any desire that you may have to change. We know we don't want to do that ahead of when we set a date. So you have an idea of whether teachers will be vaccinated or maybe they won't be. Will we likely be in the orange or maybe we'll be doing better? We want to give you a sense, a well-informed, so you can make a better informed decision about your child. So once we make the decision of the date, then we will be giving opportunities for you. It won't happen immediately, but we will definitely give you that opportunity. It really is going to be interesting for us to have a stronger understanding of whether people change their selections and what those needs are then to the systems that we've already built based on the initial selection.
Next question's a great one. If we go back and are allowed to go back in the extreme category, there is a requirement that we have on-site testing for students and staff. Are parents going to be required to sign a waiver to have their child tested at school? No, the waiver is not required, but in order to allow your child to be tested at school, you have to give written permission. And if they don't want their child tested at school, will the child still be allowed to go to school? Yes, but the child will have to be tested. So the parents will have to come pick them up and get them a COVID test or quarantine. That's what I believe to be true. Nurse Rachel.
Yes, so the testing, if we're unable to provide it, then we are required to send you to a healthcare provider, because we will only be testing students with symptoms or students who've been exposed according to the new state guidelines. And all of that would come into place starting March 1st. At this point, we just kind of all learned about it Tuesday. So we're still figuring out the details in terms of where we receive the tests and everything, but we know about the consent piece and who we're testing.
Question about the quality of face coverings. You know, what are you allowing kids and staff to wear face shields in place of masks? And the answer is no, we're requiring masks and they have to be 2-ply. We're not allowing gaiters for multiple reasons, but we will supply masks if people don't have them. And actually we encourage staff and students to bring multiple, just because I don't know if any of you have spent time in a mask. After a little while, it kind of gets wet just from your exhaling. And depending on your, I hate that sensation. And so after a while, I have to switch mine out because I just think it feels gross. We will have some students, either due to disability or accommodation for IEP 504, that may be wearing face shields or are unable to wear anything on their face. And in those instances, the staff that work with those students may have additional PPE to make sure that folks are safe, but we're requiring face masks. And again, if people don't have them and can't supply them, we will have them.
We have several questions about childcare for little ones. And one of the things that you may or may not know about is we have strong partnerships with both the YMCA and the Boys and Girls Club. And we know that both of those programs cost money. We know that the Boys and Girls Club is on a very aggressive sliding scale cost for students to be at the Boys and Girls Club right now. And I was actually going to ask Heather Huzeka if she could talk just a little bit about what those partnerships look like and what options you may have.
Hey, Melissa, I'm sorry. I'm kind of in a dark room, so my camera I don't think you're going to get me. But we are working with the Boys and Girls Club, with the YMCA, and really specifically the Early Learning Hub Family Connections at LBCC. We will be getting information out to all parents about who they can contact. And there are individuals to help families find the right childcare or infant care based on their situation and need. Family Connections at LBCC is really a key person in our region for people who live in Corvallis or other areas. So that information will be sent out to parents. We just want to review and make sure we have it all well. And the City of Albany has a community childcare website as well that hosts a list of childcare providers in our area, their contact, the ages of kids that they take. We will send out that link, but you can always just search City of Albany childcare website.
We also know that some folks need transportation to the Boys and Girls Club or YMCA after the morning session rather than transporting kids home. We just know that we are working with them so that we can arrange that for you. So we are doing our very best to try and be partners with these community partners who are providing you with their childcare.
The next is, can you provide details regarding what asynchronous work will look like? Will this be assignments they will work on independently at home, Zoom meetings with their teacher? The asynchronous work during hybrid will be work that they'll do at home independently because their teacher will be teaching a class likely of other kiddos, either in CDL or likely in hybrid. Where can we receive information about sports associated with schools? That's probably best received from the schools themselves. We know that all of the activities in sports are working with OSAA, who are working with OHA and ODE around what those requirements are. and whether or not they can either practice or competitions and things like that.
One thing about sports is we're required to follow the OHA guidance now, not ODE. So it'll go under the community-based metrics of the 200 instead of this new 350. And it'll align with the indoor and outdoor recreation requirements from OHA.
And OHA is the Oregon Health Authority. So they're in charge of everything sciencey.
Comment just sounds like after spring break is best for staff and maybe numbers will go down. So best for our students as well, from Kyle.
While you're reading, I just want to say, if you haven't written in the chat box, it's 7:26. So we're going to start shifting in a few minutes. We're going to start shifting over into Spanish. So into the next meeting where we'll repeat the information that was shared tonight. What I want to remind you to do is you can email me, and I put that in the chat for you. My email address is, or put your thoughts in the chat and we will be reviewing that. Promise. We're keeping all of the chat, and we want to hear what your thoughts are.
And it's hard. There's just so much. I'm trying to go fast. Sorry. It says my high school student is taking AP classes. If they go hybrid, they'll only have instruction a few days a week instead of 4 being virtual. How do they provide instruction for AP just 2 days a week? Are they considering changing the AP test dates? A few things to know about AP classes. Those test dates, the tests, all of that are done by AP themselves. Those aren't district or even state decisions or options. And so I don't know if they're considering changing the AP test dates. I don't know that they have made a decision or communicated anything out.
Lisa?
Yeah.
Sorry, this is Jean Gritter. I just posted a little bit further down in the chat. I posted a link for AP that is talking about their plans for test dates this spring.
Awesome.
Love you, Jean Gritter. Also, there's a reminder that the West Albany Forum starts at 7:30.
Okay. Is there a waiver that we can sign as parents regarding COVID? There's actually a waiver required right now if your child participates in activities or sports or limited in person at school, but there is not yet one and I don't know if we will have one for hybrid or on site beyond that. The document you sent yesterday said 70% of staff don't feel comfortable returning in person to learning. That's concerning to me because they are probably the most at risk for COVID infection and death as a result of on-person learning. Why would we not wait 1 more month until at least most of the staff has had an opportunity to get at least 1 vaccine? What's 1 more month after nearly a whole year of virtual learning? If a child finishes the whole school year remotely, will it affect their ability to finish the school year with the school of whom they are a part of already? So no, if your child finishes remotely, they're still, part of their home school, and they'll still be able to return to that school when they come back in person, if that's this spring or if that's next year. I'm trying to read as fast as we can. I know we only have a few minutes left. What support can be done for kindergartners struggling to keep up with the workflow? So Candy, one of the things I would say is, do your best in terms of making your best judgment with your kiddo. Some of the best things that you can do at home really are simple things like counting out loud. How many steps does it take us to get to the kitchen? We're looking around and can you find the letter B? Do you see the letter B anywhere? Oh my gosh, where do you see it? I see it in this sign and I see it in this book. And saying our ABCs and singing songs and asking kids what words rhyme with what. And when I say this, this word, what's the first sound? So all of those rhyming words, first sound, counting, letter recognition, all of those things are great practice for your kinder. And if you feel like they can't keep up with the work, I would work with your teacher. But it's all those little things and all the talking, those little games that you play with your kiddos when they're very young that are super important for learning how to read and listening to sounds, because that's kind of the first step for learning how to read.
So I am sorry. Assistant Superintendent Harlan would keep going. She would love to get through everything. And obviously we're not going to be successful at that. I want to say, I hope we answered at least some of your questions that you came into the room with. I also hope we have your feedback on what your needs are, what your desires are regarding the in-person start date. Monday night's board meeting is when we are going to make an announcement. I will announce to the board what the decision is for the start date, and the board will discuss that as well in the board meeting. And so that starts at 7:00 p.m. And I welcome you all to watch that. That would They are really informative, and hopefully we'll be able to answer more of your questions at that time, just simply through the presentation. We'll certainly take the notes from this meeting and hopefully address some of those things in the board meeting. So I just want to say thank you for being here, and I appreciate your coming together and recognizing we are a community, we're working together, and I thank you for investing your time on Thursday night. Have a good night. And then welcome to those of you.
Gracias, David, Jazmín y el personal del Welcome Center. Y Leonor. ¿Quién más?
Hola.
Patricia, maybe.
Hola, Roselia.
Celia. Buenas noches. I was going to say.
Melissa, I will stay on and continue to admit. I have that capability, so I will help out if that's helpful.
Thank you. Gracias.
And Superintendent Goff, sorry, we just finished the forum with West Albany High School, and there were a few parents that said that they wanted to connect to this forum.
Good.
They asked for the link, and so we shared that with them. We hope that they are able to connect.
Great. Great. So, Welcome Center team, to let you know, I am using the ODE slide deck for tonight. It was long. I've cut it to 30 slides. We're not going to talk about every slide. It's all written in English. So we will work together to do our best, because I want to have time for them to ask questions. It's hard.
Muy buenas noches a todos. En unos minutos vamos a comenzar con el foro en español. Nada más estábamos recibiendo unas indicaciones de la información que vamos a usar para su presentación y de la información que se va a estar compartiendo con ustedes. Superintendent Goff, I just made an announcement. We will be starting soon and sharing the indications you have given us. Thank you.
Gracias. I am going to stop the video, stop recording, and then start recording again so that we have the recording in English and the recording in Spanish. I hope this works. We shall see. Okay. Oh, wait. No, I didn't stop the recording. I turned off my camera. You can translate, please.
Un momentito, vamos a estar parando lo que es la grabación del foro que tuvimos en inglés para poder tener una grabación del foro que vamos a tener en español. Nada más que pido disculpas, dice la superintendente, en lugar de parar la grabación, apagué mi cámara.